Hi, my name's Ellen McIntyre and I'm going to be talking to both Chris Barton and Joanne Reeve about the work that they're doing with us at the moment. So, hi Joanne, hi Chris. How did the SAPC, the Australian Association of Academic Primary Care, and the Society of Academic Primary Care from the UK, how did they come to be running a workshop?
Well, the Society for Academic Primary Care has been recognising a problem with the profile of academic primary care for a while. So we've been starting some strategic planning about how we can do some work to raise that profile in the UK. And I was at a meeting in Oxford last year and met Chris and had a conversation with Chris about the similar sorts of things going on over here in Australia, similar conversations and similar problems. So we thought, we recognised that there were two conferences running close together, SAPC last week and AAPC this week, and we thought it would be really great to start having a conversation over the combination of the two conferences to start a global conversation, and that's what we did.
Can you tell us a bit more about the workshop that you conducted at this conference? I think we did it yesterday.
We've been doing some strategic work at SAPC for a while. We started with some interviews with members of the academic primary care community, and we used that to develop a survey tool to take to a wider group. And we shared that with Chris and with yourself so that you could take it to your membership over here. So we had some background information on the sorts of challenges that people are finding in the academic primary care world at the moment that we could use as a basis to start a conversation in the workshop.
Thanks. Now, Chris, what were some of these challenges? What came out of the workshops? And also, what will you do about them?
Okay, so a number of key challenges that our participants talked about. So they talked about there being a lack of a clear vision of what academic primary care is. And from that lack of a clear vision of what it is, there was no clear idea of what the roles and responsibilities were, and also career pathways that people can follow within academic primary care, and also to enter into academic primary care as well. And so having that clear vision is really necessary to be able to describe clear outcomes and indicators of good outcomes, and why it matters, and why academic primary care matters to policy and practice as well.
So thanks, Chris. And now, Joanne, what's the next steps? What are we going to do next?
What next? Well, we've got. We asked our participants to take away some plans from today, both for themselves individually, but also that collectively we could start working up. So we've got some ideas there already about starting conversations. We're going to collect those all together from the meetings, use the wiki format to start to share that amongst the participants from the group and also the wider academic primary care community. So if you like, we can identify a strategy for what we need to be doing, but also the plans for how we're actually going to do it, how we're going to bring communities together in order to put the strategy into an action plan, if you like.
Well, thanks very much, both of you. And as you can see, this is a really good example of how two professional organisations can come together, the Australian Association of Academic Primary Care here in Australia and the Society of Academic Primary Care in the UK, how two professional organisations can come together and do some really important work for their members. And we are also hoping that we can expand that and extend it to a global vision of academic primary care. So thank you very much.